What could make us suspect if a woman has fibroids? Stay with this video to the end, and I promise you will learn about the different symptoms that could possibly happen if somebody has fibroids. Hi there, my name is Dr. Sylvia. This is AskAwayHealth, where we provide you with direction and clarity about everything medical. Do consider subscribing to our website, and if you do, click the notification bell so that every time we publish a new video, which tends to be once a week on Saturdays, you'll be one of the first to know. If you've watched my previous videos in this series, you will know that fibroids are benign growths in the woman's uterus. They're fairly common and they happen in up to 30 to 40% of women. They're also one of those conditions whose treatment depends at present on the type of symptoms that present. I've spoken to lots of women of different ages, and what is mainly common is that sometimes fibroids might not be diagnosed until it's very late and somebody presents either with symptoms of really very horrendous heavy menstrual bleeding or problems getting pregnant. Okay, let's get started. Now, the most common symptom of fibroid is nothing. Basically what that means is that we've said that 30 to 40% of women could have fibroid symptoms, could have fibroids, but a lot of them don't even know, because the degree of fibroids does not cause any problem that could be distressing or disenabling them, and so they don't even realize that they have fibroids. But when a fibroid does cause symptoms, the effect can be dependent on where the fibroid is located and the type of the fibroid. In another video, I've talked about the types of fibroids and how those could affect the symptoms. Now, 1 out of 3 women will show symptoms of fibroids. Now, let me add here that fibroids can grow to different variety of sizes. A fibroid can be as small as a peanut or cashew nut, or it can be as large as a football or even the size of a full-term pregnancy. In some women, fibroids may occur singly, so that means that there might just be one fibroid in the uterus. In some other women, there might be more than one fibroid in different parts of the womb. So when symptoms are present, amongst the commonest that you will hear about are heavy, painful menstrual periods. In addition to being heavy and painful, the periods may also be longer than what a woman or the woman would normally experience after the fibroids have started to develop. Another symptom of fibroids that is quite common is having pain outside the menstrual period, that is outside the time during when a woman's menstrual blood flows. So this is pain that is located within the lower part of the abdomen or the pelvis, and that can be constant. This pain can be quite severe depending on the size of the fibroid. Now, the pain can also stretch across to the back and even affect the lower legs. Now, you might wonder how that happens, and again, I've put a link to my video on the types of fibroids because I thought that was important to understanding why fibroids could cause backaches or why they could cause pain in the legs. But if you imagine a very large bulky fibroid pressing on the nerves around the back, pressing the organs back because of its size, then you can see how so seemingly distant areas from fibroid can also be affected. So now that we've started talking about pressure symptoms, let's look at a couple more. Because of the effect of the bulky size of a fibroid on the organs like the bladder, which is normally sitting in front of the womb, it could lead to problems passing urine. So a woman might experience an urge to pass urine all the time, or she might experience an inability to control the bladder. These are possible complications that happen because of where the fibroid is located and how large it is. Closely related to that is the effect on the woman's rectum and anus. The rectum is sitting right behind the womb. So if a woman has a large bulky uterus towards the back that is pushing on the rectum or pressing against the rectum, it might prevent her from passing stools and opening her bowels normally, and she might end up with a really serious problem, for example constipation, that can develop, causing a lot of distress. This is because of the location of the fibroid. If you know someone who suffered from fibroids, or if you have experienced them yourself, what do you think is the most distressing symptom of fibroids? They range from different degrees one to another, but I'd love you to share your thoughts in the comment section below and let me know what you think are the most distressing symptoms of fibroids. Right, let's move on and talk about other symptoms. Another pressure symptom is bloating. This can be because of the weight of the fibroid pressing against the parts of the intestine that it is sitting close to, and so it's difficult. As soon as a woman has eaten a small amount of food, you feel as if you're already full and bloated. Next, some women experience weight gain. Weight gain because the fibroid grows, it's heavy, and so it makes the woman heavy, and of course looks as if they've put on weight. But in addition to making a woman heavier, the large and heavy fibroid might also cause heavy bleeding. Heavy bleeding leads to a condition called anemia, where a woman has low iron levels. Now, the low iron levels makes her tired, the loss of blood makes her tired, and that reduces the desire or motivation to exercise. The low iron level also can be associated with a craving for unhealthy types of food, which also contributes to weight gain. So you have a vicious cycle developing simply because that fibroid is present. And so whereas somebody might be able to get up and exercise, they have a low motivation to do that, and compounded with that, they have a craving for unhealthy food, and that just makes the whole picture worse. And as she grows bigger, remember that we talked about factors associated with fibroids. One of them is obesity. So being overweight actually makes the fibroids go bigger. It's a vicious circle that carries on unless something breaks it and stops the progress. And another symptom that could happen is pain during sexual activity, either because of the position or the size of the fibroid, and makes sexual activity quite distressing. And the final symptom I want to look at today is one that is so important. Because of the position of the fibroid within the inner lining of the womb, which we refer to as the submucosal fibroid, it could destroy the normal structure of the uterus, preventing a fertilized egg from being planted improperly and progressing to a normal, natural pregnancy. This could happen over and over again, leading to recurrent miscarriages and infertility. Of course, persistent heavy bleeding is also another aspect of fibroids, and that could impact on a woman's fertility. Right, that's a fairly long list of some symptoms that you can just directly associate with a fibroid being situated in the woman's womb, okay? But there are other possible complications that could happen. Imagine the effect of very heavy bleeding for several days of the month. Imagine trying to get pregnant and struggling with this, and all the other possible issues that could arise, suffering with constipation, suffering with bloating, suffering with pain during intercourse. These could all potentially have impact on somebody's mental health and psyche, and so you could have women developing anxiety and depression and struggling to manage with their usual day-to-day activities because of the fibroid. So if this is an area that you would really like to talk about further and perhaps discuss some of these symptoms that I've mentioned briefly, please send an email. I'll put the links in the description. It's info@AskAwayHealth.org, and I'll be happy to talk you through the different symptoms and how and where you can seek for help. Again, I've put a link in the description below to my heavy menstrual period checker, because sometimes some women don't realize that they're having heavy periods and should seek medical advice to know whether they have a diagnosis of fibroids or some other condition. So I think it's a useful tool. Please check it out. So that's the end of this video. Thank you for watching. If you found it useful, please like it and consider subscribing my channel, because that really helps me make videos like this every week. Also, share the video with someone, with a friend or a relative that you think might find it useful. So till the next video, take care.